Today, we are going to learn about angina, its definition, causes, factors, treatments, and nursing interventions. Reminder that this is only a memory refresher for those who are about to take their exams or just want to relearn about this topic. Subscribe and hit the bell icon for new uploads.
Angina.
Angina is chest pain caused by inadequate myocardial oxygen supply. It's usually caused by narrowing of the coronary arteries, which results from plaque accumulation in the intimal lining. Angina, the classic symptom of CAD, occurs as a burning, squeezing, or crushing tightness in the substernal or precordial chest. It may radiate to the left arm, neck, jaw, or shoulder blade. Women, however, may experience atypical chest pain. Angina isn't hard to understand. If the heart don't get enough oxygen, it hurts. Women with coronary artery disease commonly experience atypical chest pain, vague chest pain, or a lack of chest pain. However, they may also experience classic chest pain, which may occur without any relationship to activity or stress. Although men tend to complain of crushing pain in the center of the chest, women are more likely to experience arm or shoulder pain, jaw, neck, or throat pain, toothache, back pain, or pain under the breastbone or in the stomach. Other signs and symptoms women may experience include nausea or dizziness, shortness of breath, unexplained anxiety, weakness or fatigue, and palpitations, cold sweat, or paleness. Here are the 4 main forms of angina. Stable angina. Pain that's predictable, in frequency and duration, and relieved with nitrates and rest. Unstable angina. Pain is marked by increasing severity, duration, and frequency. Pain from unstable angina responds slowly to nitroglycerin and isn't relieved by rest. Prinz metals, or variant angina. Pain that results from unpredictable coronary artery spasm. Pain is unpredictable and may occur at rest. Microvascular angina. Angina-like chest pain in a patient with normal coronary arteries that results from impaired vasodilator reserve. These are some of the list that causes angina. Activity or disease that increases metabolic demands. Aortic stenosis. Atherosclerosis. Pulmonary stenosis. Small vessel disease. Associated with rheumatoid arthritis, radiation injury, or lupus erythematosus. Thromboembolism. Vasospasm. Here are some of signs and symptoms when you assess the patient with angina. Anxiety. Diaphoresis. Dyspnea. Epigastric distress. Palpitations. Pain that may be substernal, crushing, or compressing, may radiate to the arms, jaw, or back, usually lasts 3 to 5 minutes, usually occurs after exertion, emotional excitement, or exposure to cold, but can also develop when the client is at rest. In women, may manifest as atypical symptoms of pain, such as indigestion, back pain, and less severe complaints of substernal pain. Tachycardia. The following are the diagnostics test and what it will tell you. Blood chemistry shows increased cholesterol levels. Cardiac enzymes are within normal limits. Coronary arteriography shows plaque accumulation. Coronary angiography reveals coronary artery stenosis or obstruction and collateral circulation and shows the condition of the arteries beyond the narrowed area. ECG shows ST segment depression and T-wave inversion during anginal pain. ECG shows ischemia and, possibly, arrhythmias such as premature ventricular contractions. A pain-free patient may have a normal ECG. Arrhythmias may occur without infarction, secondary to ischemia. Holter monitoring reveals ST segment depression and T-wave inversion. Stress test results include abnormal ECG findings and chest pain. Nursing diagnoses: acute pain, anxiety, decreased cardiac output, ineffective tissue perfusion, cardiopulmonary. Here are the following treatment you can use to the patient as a nurse. Diet: low fat, low sodium, and low cholesterol, low calorie if necessary. Coronary artery bypass grafting. Oxygen therapy, typically 2 to 4 L. Percutaneous transluminal coronary angioplasty, PTCA, stent placement. Semifowler's position. Other alternatives include laser angioplasty, minimally invasive surgery, and rotational atherectomy. For patients with angina, treatment seeks to reduce myocardial oxygen demand or increase oxygen supply. These are the drugs prescribed by the doctor. Anticoagulants, heparin, aspirin. Antiplatelet drugs minimize platelet aggregation and the danger of coronary occlusion. Beta-adrenergic blockers, propranolol, inderol, nadolol, Corgard, atenolol, tenormin, metoprolol, low pressor. Beta-adrenergic blockers can reduce the workload and oxygen demands of the heart by reducing heart rate and peripheral resistance to blood flow. Calcium channel blockers, verapamil, Calin, diltiazem, cardizem, nifedipine, procardia, nicardipine, cardin. If angina results from coronary artery spasm, the patient may receive calcium channel blockers. Low-dose aspirin therapy. Nitrates, nitroglycerin, isosorbide dinitrate, isordiol, topical nitroglycerin, transdermal nitroglycerin, transderm nitro. Nitrates reduce myocardial oxygen consumption. Antilipidemic drugs can reduce elevated serum cholesterol or triglyceride levels. These are your nursing interventions and rationales. Assess cardiovascular status, hemodynamic variables, and vital signs. To detect evidence of cardiac compromise and response to treatment. Administer oxygen. To increase oxygenation supply. Assess for chest pain and evaluate its characteristics. Assessment allows for care plan modification as necessary. Administer medications, as prescribed. To increase oxygenation and to reduce cardiac workload. Hold nitrates and notify physician for systolic blood pressure less than 90 mm Hg. Hold beta-adrenergic blocker and notify the physician for heart rate less than 60 beats per minute. To prevent complications that can occur as a result of therapy. Advise the client to rest if pain begins. To reduce cardiac workload. Obtain 12-lead ECG during an acute attack. To assess for ischemic changes. Keep the client in semifowler's position. To promote chest expansion and ventilation. Monitor and record intake and output. To monitor fluid status. Maintain the client's prescribed diet, low fat, low sodium, and low cholesterol, low calorie, if necessary. To reduce risk of CAD. Encourage weight reduction, if necessary. To reduce risk of CAD. Encourage the client to express anxiety, fears, or concerns. Because anxiety can increase oxygen demands. The following are the topics you can teach to your patient. Explanation of the disorder and treatment options. Medications and possible adverse effects. Taking sublingual nitroglycerin for acute attacks and prophylactically to prevent anginal episodes. Reducing risk factors through diet, exercise, weight loss, cholesterol reduction, smoking cessation, and stress reduction. Avoiding activities or situations that cause angina, such as exertion, heavy meals, emotional upsets, and exposure to cold. Seeking medical attention if pain lasts longer than 20 minutes. Differentiating between symptoms of angina and symptoms of MI. Contacting the American Heart Association. Try answering some of these questions. Pause the video so you can analyze the question. A client with angina complains that the anginal pain is prolonged and severe, and occurs at the same time each day, most often at rest, in the absence of precipitating factors. How would the nurse best describe this type of anginal pain? A. Stable angina. B. Variant angina. C. Unstable angina. D. Non-anginal pain. Correct answer. B. Rationale. Variant angina, or Prinzmetal's angina, is prolonged and severe and occurs at the same time each day, most often at rest. Stable angina is induced by exercise and relieved by rest or nitroglycerin tablets. Unstable angina occurs at lower and lower levels of activity or at rest, is less predictable, and is often a precursor of myocardial infarction. During the previous few months, a 56-year-old woman felt brief twinges of chest pain while working in her garden, and has had frequent episodes of indigestion. She comes to the hospital after experiencing severe anterior chest pain while raking leaves. Her evaluation confirms a diagnosis of stable angina pectoris. After stabilization and treatment, the client is discharged from the hospital. At her follow-up appointment, she is discouraged because she is experiencing pain with increasing frequency. She states that she visits an invalid friend twice a week, and now cannot walk up the second flight of steps to the friend's apartment without pain. Which of the following measures that the nurse could suggest would most likely help the client prevent this problem? A. Visit her friend early in the day. B. Rest for at least an hour before climbing the stairs. C. Take a nitroglycerin tablet before climbing the stairs. And D. Lie down once she reaches the friend's apartment. Correct answer. C. Nitroglycerin may be used prophylactically before stressful physical activities, such as stair climbing, to help the client remain pain-free. Visiting her friend early in the day would have no impact on decreasing pain episodes. Resting before or after an activity is not as likely to help prevent an activity-related pain episode. The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals should the nurse tell the client would be best on her low cholesterol diet? A. Hamburger, salad, and milkshake. B. Baked liver, green beans, and coffee. C. Spaghetti with tomato sauce, salad, and coffee. D. Fried chicken, green beans, and skim milk. Correct answer. C. Pasta, tomato sauce, salad, and coffee would be the best selection for the client following a low cholesterol diet. Hamburgers, milkshakes, liver, and fried foods tend to be high in cholesterol. Which of the following symptoms should the nurse teach the client with unstable angina to report immediately to her physician? A. A change in the pattern of her pain. B. Pain during sexual activity. C. Pain during an argument with her husband. D. Pain during or after an activity such as lawn mowing. Correct answer. A. The client should report a change in the pattern of chest pain. It may indicate increasing severity of coronary artery disease. Pain occurring during stress or sexual activity would not be unexpected, and the client may be instructed to take nitroglycerin to prevent this pain. Pain during or after an activity, such as lawn mowing, also would not be unexpected. The client may be instructed to take nitroglycerin to prevent this pain or may be restricted from doing such activities. The physician refers the client with unstable angina for a cardiac catheterization. The nurse explains to the client that this procedure is being used in this specific case to a. Open and dilate blocked coronary arteries. b. Assess the extent of arterial blockage. c. Bypass obstructed vessels. d. Assess the functional adequacy of the valves and heart muscle. Correct answer. B. Cardiac catheterization is done in clients with angina, primarily to assess the extent and severity of the coronary artery blockage. A decision about medical management, angioplasty, or coronary artery bypass surgery will be based on the catheterization results. Coronary bypass surgery would be used to bypass obstructed vessels. Although cardiac catheterization can be used to assess the functional adequacy of the valves and heart muscle, in this case, the client has unstable angina, and therefore would need the procedure to assess the extent of arterial blockage. The client is scheduled for a percutaneous transluminal coronary angioplasty, PTCA, to treat angina. Priority goals for the client, immediately after PTCA should include a. Minimizing dyspnea. b. Maintaining adequate blood pressure control. c. Decreasing myocardial contractility. And d. Preventing fluid volume deficit. Correct answer. D. Because the contrast medium used in PTCA acts as an osmotic diuretic, the client may experience diuresis, with resultant fluid volume deficit after the procedure. Additionally, potassium levels must be closely monitored, because the client may develop hypokalemia due to the diuresis. Dyspnea would not be anticipated after this procedure. Maintaining adequate blood pressure control should not be a problem after the procedure. Increased myocardial contractility would be a goal, not decreased contractility. As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets, 0.3 mg given sublingually. This drug's principal effects are produced by a. Antispasmodic effects on the pericardium. b. Causing an increased myocardial oxygen demand. c. Vasodilation of peripheral vasculature. And d. Improved conductivity in the myocardium. Correct answer. C. Nitroglycerin produces peripheral vasodilation, which reduces myocardial oxygen consumption and demand. Vasodilation in coronary arteries and collateral vessels may also increase blood flow to the ischemic areas of the heart. Nitroglycerin decreases myocardial oxygen demand. Nitroglycerin does not have an effect on pericardial spasticity or conductivity in the myocardium. A client has a throbbing headache when nitroglycerin is taken for angina. The nurse should instruct the client that a. Acetaminophen, Tylenol, or ibuprofen, Advil, can be taken for this common side effect. b. Nitroglycerin should be avoided if the client is experiencing this serious side effect. c. Taking the nitroglycerin with a few glasses of water will reduce the problem. d. The client should lie in a supine position to alleviate the headache. Correct answer. A. Headache is a common side effect of nitroglycerin that can be alleviated with aspirin, acetaminophen, or ibuprofen. The sublingual nitroglycerin needs to be absorbed in the mouth, which will be disrupted with drinking. Lying flat will increase blood flow to the head and may increase pain and exacerbate other symptoms, such as shortness of breath. A client with angina has been taking nifedipine. The nurse should teach the client to a. Monitor blood pressure monthly. b. Perform daily weights. C. Inspect gums daily. And D. Limit intake of green leafy vegetables. Correct answer. C. The client taking nifedipine should inspect the gums daily, to monitor for gingival hyperplasia. This is an uncommon adverse effect, but one that requires monitoring and intervention if it occurs. The client taking nifedipine might be taught to monitor blood pressure, but more often than monthly. These clients would not generally need to perform daily weights, or limit intake of green leafy vegetables. Sublingual nitroglycerin tablets begin to work within 1 to 2 minutes. How should the nurse instruct the client to use the drug when chest pain occurs? A. Take 1 tablet every 2 to 5 minutes until the pain stops. B. Take 1 tablet and rest for 10 minutes. Call the physician if pain persists after 10 minutes. C. Take 1 tablet, then an additional tablet every 5 minutes for a total of 3 tablets. Call the physician if pain persists after 3 tablets. And D. Take 1 tablet. If pain persists after 5 minutes, take 2 tablets. If pain still persists 5 minutes later, call the physician. Correct answer. C. The correct protocol for nitroglycerin use involves immediate administration, with subsequent doses taken at 5-minute intervals as needed, for a total dose of 3 tablets. Sublingual nitroglycerin appears in the bloodstream within 2 to 3 minutes, and is metabolized within about 10 minutes. A client with angina shows the nurse her nitroglycerin, nitrostat, that she carries in a plastic bag in her pocket. The nurse instructs the client that nitroglycerin should be kept in A. the refrigerator, B. a cool, moist place, C. a dark container to shield from light, and D. a plastic bag where it is readily available. Correct answer. C. Nitroglycerin in all dosage forms, sublingual, transdermal, or intravenous, should be shielded from light, to prevent deterioration. The client should be instructed to keep the nitroglycerin in the dark container that is supplied by the pharmacy, and it should not be removed or placed in another container. A client takes isosorbide dinitrate, isordiol, as an anti-anginal medication. Which of the following statements indicates that the client understands the adverse effects of the drug? A. I should take my pulse before taking the medication. B. I should take isordiol with food. C. I will need to change position slowly so I won't get dizzy. And D. It is important that I report any swelling in my ankles. Correct answer. C. Common adverse effects of isosorbide are lightheadedness, dizziness, and orthostatic hypotension. Clients should be instructed to change position slowly, to prevent these adverse effects and to avoid fainting. Ankle swelling is not related to isosorbide administration. The client does not need to take his pulse before taking the medication. The client does not need to take the medication with food. Thank you very much for your unwavering attention throughout this presentation. I hope that you've learned something from it. Please subscribe on my channel and hit the bell icon for more uploads.